Welcome. My name is Karen Whitefield. I am the Executive Director of the American Heart Association here in Boston. And on behalf of the Heart Association, I'd like to welcome you to the first part of a four-part series dedicated to fostering education awareness around the greatest health threat facing women today, cardiovascular disease. This year-long series, locally sponsored by Brand 21, ignites heartfelt and informative conversations with survivors, with caregivers, and with healthcare professionals. As Go Red celebrates 20 years of making an impact on the cusp of the American Heart Association's 100th anniversary, we continue to make bold moves to save lives and pioneer discoveries. And Go Red for Women is a national movement that we bring to life in a variety of ways in Boston. We celebrate those accomplishments with an event every single spring. We invite you to join us at the State Room on April 11th, and I hope you are able to do so as we look to the next 100 years of Go Red for Women, and we prepare to meet the evolving needs of women now at every age, at every stage, and at every season of their lives as their trusted, relevant source and resource for credible, equitable health solutions. So as we start this morning, I'd love to welcome our first guest and survivor, Go Red for Women co-chair, Saraa Basaria. Saraa, so good to see you again this morning.
Great to see you, Karen.
So Saraa is an in-house lawyer at Vertex Pharmaceuticals in Boston. In April of 2022, she was diagnosed with end-stage heart failure. Her diagnosis came as a complete surprise. She'd never had a heart problem in her life. In May of 22, she received a left ventricle assist device, an LVAD, as a bridge to a heart transplant. And then in October of 23, in an unbelievably wonderful twist of events, she was deemed to be in remission from heart failure, an incredible rare occurrence. She successfully underwent the decommissioning of her LVAD in December of 23, which I think all of us would agree is an unbelievably amazing and wonderful news. And so we asked Saraa to join us here today because, Saraa, we wanted to talk to you about when you first started and you think back, what first symptoms that you experienced? What did you initially believe they were, and what made you go to the doctor?
Sure. So I want to start out by thanking you, Karen, and the rest of the American Heart Association of Massachusetts for the incredible work that you do, for empowering me to share my story. My hope is that if I can just reach one woman, makes it all worth it. So in April, they actually started in March of 22. I had symptoms of what I thought was a really bad stomach bug. I couldn't keep anything down. I started feeling really tired all the time. And I went to the doctor, and my doctor referred me to a gastroenterologist. Meanwhile, my symptoms sort of kept getting progressively worse over the course of 6 weeks. So I went to urgent cares. I went to the emergency room a couple of times. I saw gastroenterologists. I had many, many, many tests for potential GI issues, and no one seemed to be able to figure out what was going on. The symptoms were, the big one is a feeling of pressure on your chest. So when you're in heart failure, one of the things that happens is that you're retaining a lot of fluid in your chest cavity, and it feels like you're drowning. So, when I was lying down, I couldn't breathe properly. Got to the point where I really couldn't breathe sitting up either. But exhaustion, breathlessness, things like that.
Yeah, that's unbelievably scary. So talk to us a little bit about from how long from your first doctor's visit of you reporting symptoms did it take you to have that proper diagnosis?
So it took almost exactly 6 weeks between those two visits. And that may not seem like a long time, but where I was medically at that point, it was a critically long time. Heart failure particularly, and I'll leave it to Dr. Islam to discuss the sort of specifics around this, but it's one of those diseases that many has stages. And so the worse you are, the further along you are in the stages. And I have often wondered if I had been diagnosed earlier, had I, would I not have been at end stage? End stage is when you're considered for a left ventricular assist device, but plenty of people live with heart failure and manage it with medication. So the delay, I think, certainly, made my situation a bit worse. And speaking to the delay, I think it's really important to mention what the medical teams that I was meeting with thought I had, which I didn't have, which was anxiety because I have a stressful job. And, I'd been a lawyer for 10 years at that point. Sure, being a lawyer generally is one of the more stressful jobs that people can have, although I think any job can be stressful. But I wasn't new to it. I knew what my level of stress and, life stress was, and I knew it was different than that. I knew something was wrong. I just couldn't get anyone to agree with me.
So when you speak about that, because that's really interesting, like what were the diagnoses that they were offering to you when you first started seeing them? What were they telling you?
Yeah, so there were questions about whether I had some sort of questions about an ulcer. At one point, I had an endoscopy. Questions about whether I had some sort of GI, like food processing issue. There was a lot of focus on, and Dr. Islam can speak to this, but GI issues tend to pop up for people with cardiovascular disease. And the focus was, for me, entirely on GI issues. I actually never had an EKG until 2 days before my diagnosis. And now an EKG is an extremely simple, you just put some leads on someone and you press a button on a machine. And so cardiovascular disease, anything related to my heart, was just not on the list of things. It was primarily, maybe you have a food allergy, maybe, you've developed some sort of, food intolerance or something like that. And cardiovascular disease, the idea, everything that was, in my view, clearly cardiovascular, in theory, could be explained by not eating well for 6 weeks, right? So I was exhausted. I, was very dehydrated. I felt very out of sorts. And, I think largely because of my age, I was 34 at the time. It's very rare that a 34-year-old walks in with her heart not working anymore.
Right. Yep.
But, I think the fact is that 34-year-olds, 24-year-olds, 14-year-olds walk in and their hearts are not working. And, I think that's where I had to advocate for myself a lot. And Sahar, when you speak with her, I'm sure can speak to the advocacy that she did for me. Because there was a strong sort of, you're fine.
Yeah.
When you come into an urgent care or an ER and you say, I can't eat, I'm throwing up, I feel miserable,
Yep.
something feels wrong. You're not saying, oh, I felt my heart rhythm go out of whack, or, oh, I passed out, or,
Right.
something that's more overtly, an alarm, something that would set off alarms. So
Yep.
the response was, I know that this isn't fun, but you're okay.
Yeah. Yeah. And that's what's so very scary about this, right? Because it's just, I don't want to say ignored, but ignored in a lot of different ways, right? And I understand that it was within 12 hours that you went from having a medical team not even being suspicious of your symptoms that were connected to cardiovascular disease, to your family being told that you were in end-stage heart failure and may not survive the next 24 hours. So when you think about that absolutely horrific, terrifying time for you and your family, right? What do you believe finally allowed you to be diagnosed correctly?
I've thought a lot about this, and I would say it was a combination of my sister and my mom and my dad advocating for me and sort of being really relentless and their deep belief and understanding that something was wrong, right? These are the people that know me the best, and they knew that something was going on. A combination of that, and dumb luck, and it's really unfortunate because it should not be luck that is the reason why I'm sitting here today.
Yeah.
If that particular doctor who ordered that echocardiogram had not been on that day and maybe, had not had time or energy to listen to my family sort of, you know, figuratively shaking him and saying, something is wrong. And had he not ordered that echocardiogram, I very likely would not be here today.
Yeah.
And so I do the work that I do with the AHA, and I do the work that I do generally with advocacy because no woman should have to rely on luck to have her medical issues treated in a thorough and thoughtful manner.
Yeah, well, first let me just say that we are so obviously very grateful for your incredible positive outcome. I feel so strongly that everybody listening to us today feels exactly the same way. But as you said, we also know that unfortunately, many women don't have that same fortune as you. So as you think back on this time in your life in hopes of helping others, what is that one thing that you can provide to our listeners to take away from this experience in order to advocate for their own health when unexpected health symptoms come up? What would you say?
So I think what happens in a lot of situations to people of all genders and all situations, we go to the doctor, and unless we ourselves are medical professionals, even if we are medical professionals, we may feel nervous about sharing or nervous about pushing too hard. We may sort of want to defer to the person that is providing us care. I think the one thing that I would tell folks is nobody knows you better than you.
Yeah.
So listen to yourself, listen to your body, be relentless, be unapologetic about advocating for yourself. Don't worry whether you're going to annoy someone or, take too much of someone's time. If you feel like something is wrong, then you need to shout that from the rooftops because you're probably right.
Yeah, I love that you just said you know your own body and listen to your own body. All wonderful suggestions, as we all need to do a better job of advocating not only for ourselves, but also for the loved ones that we have in our lives. So, Sarah, thank you so much for joining us today and sharing your personal story. And, I'm also so happy that your sister and co-chair, Sahar, is here today to speak to us also about being an advocate as a caretaker. She is also a business litigator here in Boston and also became involved with the Heart Association as a way to give back to the community and to spread awareness about heart disease and women. So good to see you again as well.
So good to see you. Thanks for having us.
So, you had to watch your sister advocating for herself and going through a time of certain uncertainty before they came up with the correct diagnosis. So when you think back on this, what was the most challenging part of watching your sister go through this?
Definitely just having the doctor sort of have these tests come back to her with like negative results and just sort of shrug at her and say, yeah, sorry, we don't know. We don't know, Sarah. We still don't know what it is. Sorry. We don't really know what the next step is here. Well, it's not, we've done this endoscopy and it's not an ENT thing. We've done this, brain MRI and it's not a neurological thing. We've done this, this other test and it's not this other thing. And then Sarah and I kind of looking at each other like, okay, well, what's next? And then sort of it being on us to say, well, what's next? What do we do next? Who do we ask next? How do we move forward? And then probably the second prong of that hardest part was sort of wishing she would get some like horrible diagnosis so that we would have an answer, right? So we would go into these tests that, if they would come back positive or they would show that she would have something, it would be a pretty bad thing that she would have, and feeling kind of almost like oh, as soon as they would say, oh, all clear, the test showed nothing. Because the average person would say, oh, thank goodness, we're so glad they came out clear, but knowing that we would just have to be going back to the drawing board to say, well, then what is it?
Right.
That was probably the hardest part at the beginning.
Yeah, I hear you saying that, and I can understand that, because how sad is it that you're waiting for a result, and sometimes a bad result, just so that you can move forward and try to fix it, right? So obviously, an unbelievably challenging time. There's so many people that have experienced something like this, right? And when we're taking care of people, it can be unbelievably exhausting to advocate for our own health when we're sick. So when you think about that, can you tell us how you were able to take some of that weight off of your sister's shoulders and come alongside with her, right? And help find that correct diagnosis and treatment. And I know it was you, and I know it was your whole family as well, but how did you guys do that?
Yeah, and I think that this particular answer just depends on the type of relationship you have with the person with whom you're supporting and being the caregiver for. Saraa and I are close, and so I just started speaking for her at these doctor's appointments. At some point, I could just tell that she was done with having to repeat her story. So they would, come into the room, hi, what are your symptoms? And I would just this is her, this is her medical history. This is what she's been through. This is the testing she's had. This is what we think it's been. This is what's been ruled out. And, they'd ask a question to her, I'd answer it. What medicine are you on? I'd answer it. And at some point I was like, just go ahead and direct the questions here, because she's tired of it. We're tired of having her answer these questions to no avail. So I just sort of took over. I don't even think I asked her before I did that. Sorry about that. And I just started doing that. And I think that was the way that I thought that I was taking the weight off of her, to have to just repeat the story again and again and again.
Yeah, yeah. I mean, excellent tips, right? But think about the people that don't have an advocate like you, right? Or the rest of your family doing that for them. How exhausting that must be. So, great tips for the listeners for sure. We all know, since 1 in every 3 women dies of cardiovascular disease, we know that most likely everybody that is listening here today is either going to experience cardiovascular disease or be a caretaker somewhere down the line. So when you think about that, what's that one piece of advice that you would give to all of us, if we found ourselves in a caretaker role?
You cannot fill someone else's cup if yours is empty. So take care of yourself first. And when people told that specific piece of advice to me, I would roll my eyes a little bit, because I was like, no, I don't have time. I don't want to take care of myself. Like, I'm more worried about her. Like, I'm not worried about myself. Like, I'm fine. But especially when you don't know how long the road will be. And what happened with Saraa was, I mean, nothing short of a miracle. We expected what happened with her. We expected her to have the LVAD for years to come. We did not expect it to be such a short-term, kind of amazing recovery. And so, the idea that it ended up being such a short kind of stint with the LVAD, it was just something we didn't expect. So if we had been kind of doing the care that we were doing kind of for the long run, it would have been something that, taking care of ourselves to ensure that we were able to do that going forward, that would have just been incredibly essential for all of us that were, coming together to take care of her.
I love that you said, and I apologize if I get this wrong, if your cup is empty, you can't take care of somebody else's, or something like that, right? Is that what you were saying,
You can't
Sahara?
fill,
I love that. Say that again, if you don't mind.
yeah, you can't fill someone else's cup if yours is empty.
I love that. Because all of a sudden now you're taking care of 2 people, right? Somebody's taking care of 2 instead of 1. So I absolutely love that. So thank you for sharing all of this. For those of you who don't know, both of the Basaria sisters and family and friends have raised over $20,000 for the Heart Association's Lawyers Have Heart 5K road race last June, and also our Go Red for Women campaign that we're working towards on April 11th. The Heart Association so greatly appreciates the commitment to the mission, for the service that you've given as co-chairs for this year's Circle of Red. We cannot thank you both enough for sharing your experiences. And I know when we get to the questions a little bit later, there might be some more for you as well. So thank you both for joining us this morning.
Thank you.
So our last guest speaker this morning, I'd like to now introduce is Dr. Islam. Dr. Islam is a clinical fellow in advanced heart failure and transplant cardiology at Brigham and Women's Hospital, Harvard Medical School. She's a graduate of Boston University School of Medicine, where she has completed internal medicine residency. She completed a general cardiology fellowship at Emory University. And her research interests, which I absolutely love this, is in understanding social determinants of health and cardiovascular health and disease. So Dr. Islam, I know that all of our schedules are so busy in today's world, but none schedules more taxing, I think, than those in the medical profession, such as yourselves, as you're all trying to take care of all of us. So with that being said, thank you so much for joining us this morning.
No, thank you so much for the kind introduction, and thank you for having me. And I just want to say thank you to Saraa and Sahar for sharing your story. I'm just so happy and grateful for your remission. I remember I met you guys, right when we were starting to have these conversations with the team at the hospital. And I just want to say how inspired I feel by you too, your resilience, and of course, the advocacy, it's unparalleled. So there's so much for us to learn and appreciate from you guys.
I love that. 100% agree all the way across the board. I think as time goes on, people are going to get to know the Basario sisters like their best friends, because they have been such a wealth of advocacy and education across Boston. And I see that growing even further. So very well said, Dr. Islam. Thank you for saying that. A lot of people don't realize that only 44% of women are aware that cardiovascular disease is their leading cause of death. Think about that for a second. Very, very scary, right? Most cardiovascular events can be prevented with lifestyle changes and education, as we know. And we also know that women also tend to have less obvious symptoms of heart attacks, which can lead to delayed treatment. So would you mind sharing with us what some of those less obvious symptoms could be?
So I just want to start out by saying, when I'm recalling my second year medical school cardiovascular disease class. So we had a picture of an older man with a, like holding his chest, elephant sitting on it. So those are things that, are taught to us, and also what is disseminated in the media. So women can, of course, have those sorts of symptoms, but women oftentimes present with less typical symptoms. And Saraa referred to a few of them. So for example, feeling out of breath without having chest pain. They can have nausea, vomiting, feeling that they have heartburn symptoms. So oftentimes, it's thought that this is secondary to gastrointestinal issues, and they get referred to GI. And of course, all the tests come back negative. They can feel like they have upper back pain. They can be extremely fatigued. They can have dizziness, palpitations. And a lot of times, these symptoms are ascribed to anxiety, for example. However, I love what, Saraa said. It is, you yourself know your body the best. So when you think that there's something wrong, there must be, something wrong. So you need to go out there and get checked out.
I love that. I love that. And so in a follow-up to that, what are some of the underlying conditions of CVD that women should be monitoring?
Absolutely. So the CV risk factors are modifiable. So high blood pressure, cholesterol, checking out your sugar. Of course, not smoking, limited alcohol consumption, good diet, exercise, taking care of your mental health. Those are also important for cardiovascular health.
So as we want to be proactive, when you think about this, Dr. Islam, what measures can women take to monitor the blood pressure and cholesterol numbers outside of their physician's care? What are some of those little things that we can do at home?
Yeah, no, absolutely. So for one, you yourself can go to a pharmacy and buy a blood pressure cuff. You can buy it on Amazon and have it there. You can check your blood pressure a few times per week. Other things is, when you go to a pharmacy or you go to the grocery store, they have places for you to check your blood pressure. So you're welcome to do that. If you're going grocery shopping once or twice a week, you can check your blood pressure. And another thing that's really nice is, we have fairs, health fairs all across the city. And oftentimes, in addition to getting your blood pressure checked, you can also have your cholesterol checked there. And then depending on the results, you can go back to your primary care doctor. And I would like to emphasize that it's also very important to try to go to your primary care doctor at least a year.
Okay. I love all those tips. Thank you for that. And so in keeping with that same proactive vein, how much exercise do you think we should all be getting every week to protect our heart health? And then one of the questions people always ask us is, are there any supplements that we could be taking to reduce our risk of heart disease?
Yeah, no, absolutely. Those are amazing questions. So the guidelines recommend about 150 minutes of moderate intensity exercise. So brisk walking, for example, would count, or 75 minutes of higher intensity exercise. So for example, jogging. Or you can do a combination of the both. We also recommend, doing some strength training exercises. I recommend yoga, and I think, Saraa does a lot of yoga too. I think that's amazing for, not just your physical self, but also your mental state, which I think is just amazing. So, like a combination of different sorts of exercises. Also, just simple things, just walking around the block if possible is just so amazing for both your physical health and your mental health.
Awesome. Thank you for that. The yoga sounds really interesting. I haven't tried that, but I've heard wonderful things about it. So do you do that heat yoga? Is that what that is? Or do you do regular yoga?
So I've never done heat yoga. I've done regular yoga before, but it's nice.
I love it. I love it. Thank you for that. So when you think about some other tips, high cholesterol, of course, we know can increase your risk of heart attack and stroke as well, right? So if you're 20 years of age or older, I know you mentioned about seeing your doctor, once a year. How often do you think that we should have an assessment of your risk of CAD or related issues?
Yeah, no, definitely. So if after you're in the age of 20 plus, so it depends on different guidelines. So seeing your doctor is extremely important. So we say about 4 to 5 years getting your blood work done and monitoring, your other cardiovascular disease risk factors. And the guidelines, vary by, gender oftentimes, but I think, just going to the doctor regularly, they'll be able to tailor when to check those measurements.
I love that. And, if people don't know, National Walking Day is April 3rd. So, spring is in the air, spring is beginning. If we haven't gotten out there yet into the, the beautiful, it's raining today, but let's just pretend it's not raining today. If we haven't gotten out there yet, let's kick that off on April 3rd and start this right?
Absolutely. And I'm there with you.
I love it. I love it. So, we also know that women are twice as likely to be diagnosed with depression, right? And, especially through the pandemic, 80% have said that their load increased at home and at work. And I remember talking about this with some people, especially around the holidays, right? It gets even worse because it seems like women are the ones who have to take care of everything for the most part, right? We are the caregivers. So we're definitely developing solutions to promote positive well-being and support across every stage of a woman's life. And when you think about that, one of those stages is menopause, right? So how does menopause affect cardiovascular disease in women?
Yeah, no, that's an extremely important question. So, when a woman undergoes menopause, there's a lot of hormonal shifts that happen. There's a lot of symptoms that women have to deal with. Your body is undergoing a lot of change. So, in addition to that, your risk of cardiovascular disease risk factors increase. So, for example, you may have higher levels of cholesterol, triglycerides. Blood sugar may increase. You're at a risk for what we call metabolic syndrome. You may have increased waist circumference. So it's because of all the changes that your body is going through. So it's extremely important for us to be mindful of, these changes and ensuring that we are getting these, cholesterol levels, blood sugar, all of these checks so we do not develop these syndromes, which end up leading to increased risk of cardiovascular disease.
Yeah, thank you for that. That's obviously so very, very important. We have so many questions, Dr. Islev, that we'd love to ask you, and we could take all day long. And we're going to be answering some additional ones in the chat. But I guess one of the last questions I wanted to ask you is, we know that the US has one of the worst maternal mortality rates among developed countries, and pregnancy-related deaths are definitely on the rise due to cardiovascular disease. Black women pay the highest price, followed by Native American, followed by Asian, followed by Hispanic women, right? So how does research play a part in closing this gap in health disparities?
No, absolutely. So there's multiple folds, and this is, my research interests are in social determinants of health. So I see it as, a multifold approach with research. So first of all, it's extremely important to elucidate these disparities. And I think there's brilliant researchers across the countries, not only, medical people, but also, social epidemiologists, psychologists who come together to elucidate these risk factors. So how neighborhoods are associated with cardiovascular health, for example. These aren't things that we knew 15, 20 years back in the day. So these have been elucidated. So increasing awareness by elucidating those disparities. And then the thing is, what do we do about the disparities? And I think that is, it's the crux. It's extremely challenging to figure out interventions. So, research, of course, can help us figure out scientific methods to improve health in different vulnerable communities.
Yeah, so truly very, very well said. Thank you for sharing all of that. Again, this is one of the very many reasons why our Go Red for Women movement and the event on the 11th is so important to not only our community, but in supporting all the women in our lives that we've been fortunate to know and to love. So thank you again for sharing all this. This has been unbelievably helpful. And, again, this is the first of 4 series that we're going to be doing throughout the year, with more information coming. But as we start to wind down this morning, I first want to thank Sahar and Saraa and Dr. Islam for sharing their expertise and experience this morning. We appreciate each and every one of you for your advocacy, for your education, for your compassion, for your insightfulness, as we all work together to make a difference in each of our loved ones' lives. And with that, I want to turn it over and welcome Lauren Rucker. Lauren is our manager of our Go Red for Women campaign and our event on April 11th. She's going to take us through some of the questions that so many of you were kind enough to put into today's chat. So please join me in welcoming Lauren. Lauren?
Thank you so much, Karen, and good morning, everyone. I echo, of course, the thankfulness and gratefulness that we have for Saraa, Sahar, and Dr. Islam joining us. And thank you, Karen, for facilitating the conversation. Yes, my name is Lauren. I am new to AHA, and we have started off this year, the 20 years of Go Red, in an amazing way. And we'll be celebrating all the accomplishments of this year on April 11th in the State Room here in Boston, and we'd love if you all would join us. I wanted just to take some time to look into the chat to see if we had any questions, and I did see one question that was geared toward advocacy. Stesha, if that's how it's pronounced, mentioned that they love the line about being an advocate and knowing your own body. I found that checking in with loved ones about their own experiences with health. I find that in this culture, sometimes we don't share. Was there any were there abilities that you utilized outside of the medical community? And I guess that would be geared towards Saraa and Sahar.
Yeah.
So thanks for a great question, Stisha. I think it's a really great question and a really good point that, we all have our community, and Sahar and I have a wonderful community. I certainly, as the person going through it, reached out to my friends, to family members. I reached out about my symptoms and sort of, have you experienced this? And what do you think is going on? Mostly, I reached out for a gut check. Like I said before, sometimes we have a hard time sort of standing up for what we're saying when we're talking about our symptoms, especially if the response that we're getting is sort of a "you're fine" response. And what I reached out to my community for was, am I crazy? Is this weird? Am I overdoing it? Am I being dramatic? And so I think a big part of what my community did for me during that time was remind me that my instinct is probably correct and that I should keep advocating for myself. Sahar, I'd love to hear what your thoughts are.
No, I agree with you. And then the reason that I wanted to speak onto this point is because our specific goal, Saraa and I, our specific goal with, our involvement with the AHA too, is there are so many others like Saraa. There are so many other women, specifically women of color, and then also, people in the LGBTQ community, specifically non-binary folks that are assigned female at birth, that do not have the ability to look to their community for a shared experience to say, has this happened to you? Because if they do, then what they're going to get probably is, oh yeah, I mean, I was told I was fine, and then like something really bad happened to me as well. Not, oh no, that happened to me, and it, this is the care I got, and you should advocate for, this, and this. And so I think that's a really good question, because it not only highlights like the reach out that you want to be able to do, but also a gap of reach out that right now you might not be able to do, because certain communities are still sort of underserved with regard to advocacy in that specific area in the health equity space.
Thank you so much, both of you ladies. I do have another question here for Dr. Islam. And this is from Allison, I believe. And Allison wants to know, how is the blood test, how is cholesterol test administered? How would one get that? And how many times a year is that measured? Or should that be measured?
Yeah, no, that's a extremely good question. So cholesterol is usually checked at the it is a blood test. So they take a vial of your blood and they run it. Back in the day, there was talks about, doing it as a fasting measurement, but nowadays, it's less common for us to do that. Sometimes we do it, but oftentimes we'll just get a random measurement to see how your cholesterol is. So there's 3 markers that we look for: is total cholesterol. We look for your good cholesterol, which is your HDL, and then we look for your bad cholesterol, which is LDL. So taking all of that together, your doctor is able to decide whether you would benefit for medical, like, pills, or whether, lifestyle interventions is what we need. So you can do it that way. And I think I saw on the chat message that the question is, what is the, in fairs, how is the test administered? So it's a little less precise, the screening test that they prescribe at the fair. So for example, if you had your blood drawn at your primary care doctor, after you've administered the treatment, I would get it done at the primary care doctor again. So you're using the same measurement to understand your response to the treatment.
Thank you so much, Dr. Islam. And just to make sure, at the end of Allison's questions, we have here, is there a supplemental test afterwards that should be done as well?
No, not a supplemental test. So it's usually like the test is called a lipid panel. So you have a bunch of numbers there. So as I said, total cholesterol, HDL, LDL. So you measure that. And then you can measure it in different frequencies depending on the treatment that was prescribed to you. And what I was saying is, when you go to a fair, the measurement, it's more as a screening test. So it's not quite as precise as the one that is done at a hospital or a clinic.
Well, thank you so much, Dr. Islam. We are, of course, running out of time. I thank you so much to Dr. Islam, Saraa, and Sahar for ending out that QA. I really do appreciate it. And of course, as we close out this morning, thank you all for your time. And again, we welcome you on April 11th to celebrate the long years worth of work of AHA in women's health. And of course, we invite you to be a part of this particular community year-round through our Circle of Red. We will be in touch with you all soon, everyone that has registered, to find out how you can be a part of this movement. And thank you again to Brand 21 for sponsoring this first part of this 4 series. Thank you again, and I hope you all have a great morning.